today we will be studying the important images in the Obs Gynae section. First is the image of supports of the vagina, or basically we say the supports of the uterus. The topic is there are three levels of sport, and it is known as D. Lance's classification of sport. The level 1 is upper level 2 is middle level, and level 3 is lower level. Upper level is cardinal or uterosacral ligaments. Then level 2 is pubocervical, rectovaginal, and levatorni. And level 3 is perineal membrane and urogenital diaphragm. Basically, we need to remember that level 1 to 3 is from above to downwards. And in the level 1, it is uterus and sacrum. And in the level 2, it is pubis and cervix, vagina and rectum, and levator. And in the level 3, it is more superficial, that is perineal membrane and urogenital diaphragm. Then next we have the diameters of the pelvis. First is pelvic inlet, then we have the pelvic cavity and pelvic outlet. In the pelvic inlet, the largest diameter is the transverse one, that is 13 centimeter. Anteroposterior is 11 and oblique is 12. And in the cavity all the diameters are equal, that is 12. And in the outlet, the anteroposterior diameter is 13 and transverse is 11. Okay, so we need to remember that in the inlet, means in the above region, the transverse diameter will be more, and in the outlet region, the anteroposterior diameter will be more, and transverse is opposite. Then we have the pelvic cavity. Pelvic cavity in the upper region, it is also known as plane of greatest pelvic dimensions, and then mid pelvis, and then obstetrical outlet. And in the region of obstetrical outlet, we have the plane of least pelvic dimensions. Plane of least pelvic dimension is in the outlet, and plane of greatest pelvic dimensions is at the level of the inlet. Then this is the image of Leopold maneuvers. In the first maneuver, we can see that it is palpating the fundal region. Then in the second two hands, one is palpating the back and other is palpating the limb of the fetus. In the third Leopold maneuver, we use only one hand and it is used to see the head. And in the fourth, we use the two hands, and here the doctor is standing facing the feet of the patient, and two hands are used parallel to the inguinal ligaments. Leopold 1 fundal grip, then Leopold 2 is lateral grip, Leopold 3 is pelvic or Paulick's grip, and Leopold 4 is by using the both hands. Okay. Then this is the image of supine hypotension syndrome. In this image, we can see the pregnant lady is lying flat and straight on the bed. So her vena cava is compressed. And in this case, in the supine hypotension syndrome, that is in the supine position, the blood pressure will come down and it will hamper the circulation and the perfusion to the baby. So, we recommend that the pregnant lady should remain in the lateral decubitus position. In the lateral decubitus position, the pressure will be relieved off from the vena cava. Then this is the graph showing the images of cervical dilatation. Here we will see first one is after 3 centimeter. We know it will be the dilatation. Before the 3 centimeter it is latent phase, and after 3 centimeter it is active phase. This whole is active phase, and if the 3 centimeter area is prolonged, then we say prolonged latent phase. Prolonged latent phase means this from here it should start but it gone up to here. Prolonged latent phase. Then is primary dysfunctional labor. Then is secondary rest. Secondary rest means it was progressing okay, but in the afterwards time it becomes flattened, so secondary rest. The two main which we need to remember is secondary rest graph and the prolonged latent phase graph. Prolonged latent phase graph. Then this is the simple representation. Precipitous labor means बहुत जल्दी हो गया. Then is multipara. In multipara it will be faster. Then in primi it will be slower than the multi. Then arrested active phase will be means first it was progressing according normally. Then it becomes flattened. Arrested active phase or secondary rest. Then is prolonged active phase. Prolonged active phase. Then is prolonged latent phase. Then these are the ultrasound appearances. This is showing the double bleb sign. One bleb is this and one is this. It represents the yolk sac and the amniotic sac. Then this is intradecidual sign. Intradecidual sign. And this is double decidual sac sign. Two rings are present concentrically. Double decidual sac sign. Then this is the ultrasound showing the snowstorm appearance on it is present in the molar pregnancy or hydatidiform mole. Then this is the image of endometrial polyp. Here is a filling defect in the X-ray and it is indicative of endometrial polyp. Then this is the image showing the lady undergoing the non-stress test. It can be asked as a spotter and as an important question in the exam, that what is the procedure going on. It is non-stress test.